Hello, and welcome to this informational session about the Division of Clinical Ultrasound's Advanced Clinical Ultrasound Fellowship at Nuvance Health. We are located at Vassar Brothers Medical Center. So a little bit about our program. You start on August 1st as a fellow. This gives you a little bit of time after residency to move in, enjoy some needed time off, and get settled into your new home. So the mission statement of our program is to craft excellence in an ultrasound educator through a solid foundation of clinical knowledge to supply you with the tools to engage, instruct, and inspire lifelong learners who both yourself and the learners aspire to advance our field. We plan to do this through laying a solid foundation of clinical knowledge upon which you build. In addition, we will give you the skills to be an excellent lecturer and teaching, to be engaging and spark that fire in learners that's necessary to be a great teacher. We will also support and coach you during your learning process to make sure you've gained the right tools to be an effective teacher. And finally, we hope you will continue to think of ideas and ways to advance our specialty and to continue bringing it to new fields such as EMS, internal medicine, family medicine, pediatrics, and the sky's the limit. So these are pretty lofty goals. So how do we plan to do all this? So we're going to build our program upon the 4 pillars: education, bedside teaching, administration, and research. So our first pillar is education. We start your month off in August, where your fellows are your only learners. Initially, we begin with a 2-day ultrasound workshop, where we focus on image acquisition and basic ultrasound applications. And then day 2, we move on to advanced ultrasound applications. This workshop will also include standardized patients, so you can practice your ultrasound skills. Also in this month, you will receive a series of how-to lectures. So how to give good lectures, how to build good PowerPoint slides, how to be an effective teacher and coach, and how to effectively time manage. In addition, we have weekly image review with approximately 6,000 plus images that are reviewed yearly. There'll be a monthly fellows conference, which includes an advanced ultrasound lecture, journal club, and case conference. We also do bi-monthly sim, which will either be in the sim lab with standardized patients to practice your ultrasound skills on, TEE simulators, time in the vascular lab to practice carotid ultrasounds and arterial duplex, or time in the OR for both TEE practice and regional anesthesia. As part of our ultrasound education, we are also heavily involved in faculty development, where we run a faculty ultrasound track throughout the year. In addition, we're heavily involved in resident education, both from internal medicine, family medicine, and emergency medicine. And we also run every other month nursing education for ultrasound guided IVs. The goal of all of these programs is to teach you how to run an educational program wherever you go. Our next pillar is bedside teaching. So again, we have 60 plus residents from all different specialties and students, both PA and medical school, who rotate through our POCUS program. We run 4 days a week with morning and afternoon scanning sessions and a lecture in the middle. And we have 3 learners per session to keep the group small. So our approach for bedside teaching for our fellows is graduated. So one with increasing responsibilities as the months progress and your skill and teaching style improve. In the beginning in August, will be fellow and faculty scanning sessions only. So no residents, i.e. one-on-one coaching. In September, you'll start as part of the scanning team for the month and gradually start to lead the sessions with faculty oversight. By October, you will be expected to lead the team again with faculty present and oversight. And finally, by November, you will lead the full sessions without any faculty involvement. Our next pillar is administration. Fellows will be heavily involved in image QA, and we have about 6,000 images a year that are QA'd. Again, this will be run by the fellows, but faculty will be present and there for support and oversight. You will also be tasked with managing machine disinfection, maintenance, purchasing across different departments and through the GME, as well as dealing with warranty and making sure that biomed and IT are up to speed and items needed for the department. We are also CUAP accredited through ACEP, and it will be your job to make sure that we maintain our accreditation through updating guidelines, policies, and our procedures. You will also be involved in our year-long ultrasound curriculum dedicated to our faculty and attendings who want to learn ultrasound basics, both image acquisition and only image QA. Our goal is to help get non-credentialed docs the needed education and scans. For our IM and FM folks, we use the CHEST criteria, and then for EM, we use ASAP guidelines. This program runs every year from March to March, and again, we'll start with the 8-hour hands-on workshop and mini lecture series. Every month, we will QA their images, and we give a more in-depth lecture on each topic. Our final pillar is research. We will help you from inception to design and manuscript development, poster presentation, and ultimately journal submission. We have an involved research department at the hospital that helps with research design and methodology as well. We will meet with monthly check-ins with your ultrasound faculty and quarterly meetings with the research division to make sure that you stay on track. So requirements for graduation from our fellowship, and this is a standard requirement across all ultrasound fellowships. You must complete 1,000 POCUS exams. You must submit an abstract to a national meeting such as ASAP, SAEM, or AIUM during fellowship, and it must be accepted. You must run 5 teaching shifts a month. You are limited to less than 90 clinical hours a month. You must give 4 grand rounds plus lectures to attendings during their workshops. And then by completion of the fellowship, if you are eligible to sit for the ABEM, EM boards, you will also be eligible to sit for the Focus Practice Designation ultrasound boards. And finally, you must attend the AIUM annual conference. So let's talk money. So when it comes to stipends, you get $1,800 in CME funds, $2,000 for relocation, and we pay for the travel expenses and conference for the SCUF annual conference, that's the Society of Clinical Ultrasound Fellowships, and for AIUM. So with us, when you join our program, not only are we here to be your mentor, but we're here to be a lifelong friend. And we're here for the journey to watch you grow and develop, not just personally, but also professionally. In addition, we are also vested in your personal growth, and we will supply you with a few choice books to read or audiobooks to listen to if you prefer during your fellowship to help with goal setting, time management, teamwork, how to be a better teacher, leader, improve your mindset, and of course, marketing. So finally, our aim is to teach you the foundations of clinical ultrasound, give you the tools to develop your own ultrasound program, craft your teaching skill and style, and guide you through professional and personal development, and to remind you to always keep striving towards excellence. So what are our expectations in fellows? Well, it's all about the effort. We expect you to give your best effort. Work hard because this is a short time in your life, and be committed to learning fully. We also expect you to be a great teammate. Goes along with working hard. We want fellows who will elevate our team and the division. Again, you are a reflection of us. We want you to be a good person. Be humble, be proactive, i.e., read the books. And we want you to always stay curious, always keep learning, and keep a growth mindset. And of course, the only way you can improve upon yourself and we can improve our program to make it the best is through lots of feedback. So expect it both from your faculty, and we expect it from you as well. So a little bit about our hospital. We are Vassar Brothers Medical Center. We are a level 2 trauma center. We are a STEMI center. We are a stroke center. We have a 360-bed inpatient pavilion. We have a 62-bed emergency department with 70,000 visits a year. We have a high admission and high acuity rate of about 27%. Our EMR is Cerner, and we are home to 7 residencies and 6 fellowships. So a little bit about our ultrasound fleet. We use Butterfly Enterprise as our workflow system. We have an Export, an SFAST, a Spark, Butterflies, and Lumifies in the emergency department. For my IM folks, you have Butterflies for the floor, and in the ICU and step down are Lumifies. So a little bit about your schedule. So per month, we limit you to 60 clinical hours with the ability to moonlight if you have time. We do 16 scanning shifts, which are staffed by faculty. Again, any day that you are not clinical or expected for other ultrasound responsibilities, we do expect you to be involved in the scanning shift. We lead 4 QA sessions a month, and we will be expecting fellows to join 4 one-on-one faculty scanning sessions. The weekly schedule for the residents look like an AM, an ultrasound lecture, and then a PM scanning session. Our fellows will have a one-on-one scanning session weekly with image QA. Typically, QA is with all of our learners, And then monthly, again, you will have your fellows conference, journal club, and research meeting. And then bi-monthly SIM, OR time, or vascular lab. So for those who are unfamiliar with the Hudson Valley, stay on board so you can learn a bit more about our beautiful area. For those who are familiar with it, this is the end of our presentation. So a little bit about the Hudson Valley. So we are in the mid-Hudson Valley along the Hudson River. It's absolutely beautiful. Tons of outdoor activities, hiking trails, rail trail. It's a 1 to 2 hour drive to pretty good skiing, lots of rock climbing, bike trails, absolutely kid and family friendly, lots of outdoor activities, parks, skiing, good school districts, sports, summer swim leagues, winter swim leagues, adult team leagues. This is a shameless plug for my kids. Sorry about that. From ice cream places to restaurants for high tea and baking classes to the CIA, which is the Culinary Institute of America, one of the premier training places for top-notch chefs, lives in the mid-Hudson Valley. So tons of great restaurants and food around. Again, lots of orchards, wineries, pick your own, you name it. Again, lots of fun indoor activities like rock climbing and go-kart racing. And we're also home to some really cute towns like New Paltz, Beacon, and Rhinebeck. Thank you so much for listening about our program.